My name is Sierra, and my mom was given a stage 3C metastatic ovarian cancer diagnosis a little over 2 years ago. She had surgery and went through 3 types of chemo, but nothing has worked. We live in the state of Oklahoma that doesn't have a medical aid in dying option. We will probably end up in Oregon since they offer non-residents to have that choice. My family and I have decided that whatever my mom decides, we are in full support of her. My mom is a fighter, but she wants to feel like she has the option. Dr. Phil, what are my mom's end-of-life options? And should we help my mom in assisting her death if this is her wish?
Well, Sierra, it's good to meet you. I'm sorry that your mom is ill. Robin and I have family in Oklahoma, so...
I know you're from Veneta.
I was born in Veneta, but not at the state hospital. There was another hospital there. Now, you've been listening to everything we've talked about here today, so before I say anything, has this informed your thinking at all, what you've heard today?
Cancer is what's killing my mom. It's not her choice to leave whenever she wants, regardless of if that's through hospice or, medical aid in dying. And cancer is going to be her death. It's her choice how she wants to leave. And I fully support that.
It is terminal, and they've made that clear to her.
She has the rarest and most aggressive type of ovarian cancer. There is no cure.
Has she made a decision about that? Does she know what she wants to do?
She does. She would, prefer to have the medical aid in dying option. Giving her that choice will let her have her life back in a sense.
There have been studies done about this, and it's not the pain that causes people to elect this the most. That's like 25%.
Right.
The number one thing was the loss of autonomy, not being able to be in control of yourself and your life, not being able to enjoy those things in life that you lived for was close behind. The loss of dignity was very high, saying, if it's an inalterable outcome, why do I have to be personally demeaned before I do that? And it's not what others would think about judging them, but how they feel. And, those are really big issues for people. How does your mother feel about those things? What's her thinking?
She just wants to be able to have the choice. She doesn't want cancer, like Brittany, she doesn't want cancer to be in the driver's seat. She wants to have that choice if that's an option for her.
It's the autonomy.
Right. I'm not one to say whether she's fit or not for this program. But if she wants to try it and she qualifies and, that's her choice, our family will be there to support her 100%.
Would she be someone that would let someone tell her it's not her right?
Probably not.
Do you want to say something?
Well, I wouldn't frame it that way. That isn't what I'm saying. You're all going to die, by the way. It only takes one psychologist to change a light bulb, but the light bulb has to want to change. Kubler-Ross is saying this is when people are going to look at their suppressed issues that they don't want to deal with. You can help people become actualized.
I just have to say, because I am around so many people who choose this option.
I am as well.
Who choose the option of medical aid in dying.
Yeah,
and
causing death.
Those people absolutely 100% are choosing life.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.